much for joining our webinar this afternoon. We're very happy to host these sessions, which we've been hosting for the last few months during the COVID crisis, and I think we've had such wonderful feedback with regards to how helpful they have been for the industry, and I'm very pleased that we're back up and doing some more again this week. Joining us this week, we have got a panel to take some questions. The Q&A session will be hosted by Ian Booth, who's also a fellow SOFHT director and company secretary for SOFHT. He's also global vice president at Martin Brower UK for food safety and quality. So joining us on the panel today, hopefully, we've got Phil Baldwin, John Richardson, Fiona Fleming, Peter Mather, Emily Elliott, and Kate Field. So thank you very much to our panel. We're here to take questions. This is a very relaxed session, so I'll hand over to Ian, who'll chair the Q&A session, but please do feel free to ask questions on our topic around PPE and social distancing today, but also please use the chat function on Teams if you want to type your question in chat. Ian and I will be keeping an eye on that. And if Ian's there, I'll hand over to him.
Thank you, Fiona. Hello, everybody. We're going to focus on PPE, as Fiona says. As I started talking to the panelists in preparation, there's a fair amount of areas around PPE, more than I really understood. So we will focus on that and then move into social distancing, dependent on time. But as far as then the structure, what we're proposing is to start with Ansel to give some sort of background to PPE, protective equipment, and then discuss with ISS the sort of practical management within factory environments that they're seeing, and then move into BSI with Kate, and then the second section into manufacturing, retail, and food service. So just to remind you, this is being recorded. We did have one other panelist, 3M, who were hoping to join. I think they're just working on some areas within the healthcare sector and some calls at the moment. So we're hoping they'll join us for a future event. So the first areas we get going is to discuss with Ansel around some of the detail of PPE. So Phil, I know yourself and a couple of your colleagues are on the phone. Some of the questions that we've had around related to sort of specifications of PPE, availability, cost, training. Just from your view, what are the types of things that you're being asked by your clients around PPE?
Yeah, good afternoon, everybody. And firstly, let me say how delighted we are to be participation in this discussion, and indeed to be gold members of SOFHT. As you said, my colleagues from Global are also separately on the call, Paul and Ivan, and I'm responsible for the UK and ERA. I think as you hint at, there are a number of hot topics in particular in PPE in the here and now. Our particular area of manufacturing expertise relates to hand and body protection. And I think, as you've already touched on there, top of the list by definition is supply itself. It's obviously very well publicised that there are acute shortages of multiple different elements of PPE categories. Be they masks, gloves, chemical suits. I think they're the ones that are probably hit most significantly. And I guess spinning off from that initial shortage and lack of supply, that there are then various different strands. So it's certainly the case that product is coming into the marketplace that isn't to the correct standards, doesn't meet regs, or potentially doesn't meet regs. I think an example of face masks, for example, the chair of the BSIF quoted not too long ago was an incredible statistic where I think of 62,000 companies containing the word mask out of China, 25,000 of those were established in 2020. So certainly the new startups and the regs is a key topic for us. Other things that were going on pre-COVID, which are also now relevant, are the changes to the old standards, which have been in place for many years in relation to hand protection. So the EN ISO standards that changed in 2016 and that were and still are coming into effect are also now cutting across the availability and the supply, and basically that's forcing reviews of disposable product where people wouldn't have traditionally done that or didn't think they needed to do that. But of course, that's now being forced by virtue of the supply situation. So that could even be reusable gauntlets or even mechanical products where disposable products were previously used. And of course, there are some pluses and minuses to that. There are environmental gains and CSR gains from a plus point, but the cost per item and how do you go about cleaning, sanitizing, sterilizing product is obviously a whole different ball game. And then finally, again, as you mentioned, the spiraling cost and how that can be maintained within the supply chain is the reality. And again, the extent to which the product is manufactured or supplied then impacts on the extent to which the cost is spiraling, because for sure there are cost increases in the market, but not to the extent in terms of justification that obviously people are, dare I say, taking advantage in certain circumstances, and costs are spiraling well and truly out of control. So I suppose there could be a few elements that we're contending with, and there are several more. But that would be an initial thought, I guess, from our side.
Thank you, Phil. And you previously said around people versus product, and you're seeing a shift on the focus of PPE. Do you mind just elaborating on that?
I think that what we mean by that is clearly within the food industry, experts at food safety, experts at implementing best practice and so on and so forth, but versus other industries, and this is not at the sort of top end with with high cut resistant products, of course. But the extent to which the fundamental purpose of PPE might traditionally more have been about protecting the product, it's now more significant, I think, within broader food industry and service, that obviously the people are every bit as much important. Not that they weren't in literal terms, but that balance now of the two has I think changed to some extent. And again, things like there are products in the disposable category that have been rated for the 2016 standards as EN 3745 virus protected in the case of disposables, or 1149 in the case of actual body protection, and that wasn't previously requested to anything like the same degree as now. Obviously, that there is a virus within within the community, that this is now almost being demanded much more regularly than previously.
Thank you, Phil. Now that might be a good segue into ISS and John around the actual use of that equipment and the types of demands that you require. Phil, as far as we've obviously got chat function open. We'll watch for any other comments that come through that either yourself or any of your colleagues can cover. So thank you. So if I could move on to John, just within a manufacturing environment, maybe just explain what ISS do and your involvement in use of PPE.
Okay, so hi everyone, hope you're all well. So we've actually brought together a short presentation, Ian, so are we able to share that?
We can. How long was that for, just so I can keep in mind on time?
Maximum of 10 minutes. I can talk quickly.
we're going to be a bit limited. We've got about 7 different presenters.
Okay.
Is it possible just to give an overview? What we could then do is we could plan to cover that in maybe in a future event. So I'm just mindful of the number of presenters we have.
Yeah, that's fine.
Okay?
So just an overview of ISS. I guess in the UK, we've got approximately 42,000 employees, but we have a designated food manufacturing sector. Within that sector, we offer multiple services, which include things like security, front of house, reception services. But I guess we specialise in things like our catering, cleaning, production cleaning, as well as waste management. So we've had a number of challenges, like you say, around obtaining PPE, getting the right information to our employees, but we've looked at it from another angle in terms of we haven't rolled out PPE to all of our employees. We've taken a step back. We've looked at the existing control measures that each and every individual site has got in place, such as social distancing, such as temperature checking, etc. And then we've taken it on a case-by-case basis of whether PPE is needed or is not needed. So I guess a couple of examples are security teams normally just wear safety footwear, high-vis vest, no other requirements for PPE, but now with the COVID-19, they're undertaking temperature monitoring, they're dealing with visitors, delivery drivers, and they're also working in quite an enclosed environment as well. So we've taken the decision to roll out things like fluent-resistant surgical masks and gloves to those employees, regardless of the additional control measures in the background, such as social distancing and personal hygiene. Whereas we've looked at other tasks, such as our waste operatives, an individual working by himself, not necessarily a lone worker, he can social distance at all times. So we've deemed that as not a requirement for any PPE, full stop, in terms of specifically for COVID anyway.
Thank you, John. I think I know Sue's just sent a message on chat, so we can maybe put a link to the presentation, maybe do that through SOFHT website, so people can have that level of information afterwards as well. Thank you. Paul, is there anything you wish to add? I saw you popped on and off mute a few times, but
yeah, sorry, I was there because the phone was ringing. No, I think John's right. Our position around the PPE is probably the same as it was pre-COVID. Is that it's the very last line of defence. What we wanted to do was John was right. We resisted a blanket rollout of additional PPE because was it really going to offer an elevated level of protection to the person, to the people they were coming in contact with, or to the product? What were the cost implications, but also what were the psychological implications? We have seen it with members of the public that they put a mask on and they think they turn into Superman and they can't catch anything. Yeah, we've all seen it. So we've looked at it and we've talked about the rest of the risk-based approach and all the other control measures that are in place. So the increased pre-screening, self-assessment prior to people coming to site, temperature check-in, social distancing, education and training, all of those things that we're putting in around the workplace, more so for the people that have been working at home and are now coming back, but also for our people that have continued to work in the factories. And the additional PPE is the last line of defence, where we believe that the other control measures aren't going to offer sufficient protection. And I think it's very much an approach of a combination of control measures. But I have to rely on John and on the suppliers to specify the exact type of PPE. And that is something that has really highlighted around our industry, that a face mask isn't just a face mask. There is a hell of a lot more to this. And that's been quite enlightening. And I think that's good. That's a good thing.
Thank you, Paul. I know we've had a comment come through from Andrew Green. So maybe before I move to Kate, Andrew, is it easier if you just explain your proposal?
Yeah, absolutely. Yes. Yeah.
Thank you.
First of all, thanks very much for letting me join the conference call. Yeah, there have been a number of protocols in place, and certainly an FDA-approved protocol for disinfecting N95 face masks using hydrogen peroxide vapor. Now, this has primarily been done in the healthcare setting, and we thought it would be quite useful if somebody wanted to maybe participate in some form of trial for the F&B industry.
And oops, sorry, I've lost my screen now. Sorry. So the what's the most appropriate way of being able to do so?
Well, if there's, I mean, perhaps maybe after if I could leave my, my contact.
Yeah, if you're able, sorry, maybe liaise with Sue in the office, and then if people are interested, then to do so, maybe approach through the office.
Absolutely, yeah. As I say, it's one of those things. I know that obviously there are shortages of PPE at the moment, and as I say, this may be a way of getting around it because, as I say, certainly in the FDA-approved trials, they were able to recycle the masks up to 50 times. So obviously that could have both environmental and cost implications for the people using them.
Okay, thank you, Andrew. Right, so I've been noted that. I was going to move to Kate. I know also had another question come through. Check my technical skills. Hi, David. So around temperature monitoring and maybe a discussion around temperature monitoring. So maybe we could just hold that and keep some time to talk about the temperature monitoring. If anybody has any views or experience on the calls, and I know it's something that within our business we're looking at. I'm sure a number of other businesses are. So maybe we move to Kate, and then before we talk through food service, retail, manufacturing, we just touch on temperature monitoring if anybody's got an experience of that. So Kate, to yourself, I know from a BSI perspective, you again have clients asking you a number of questions related to PPE. Are you able just to elaborate on some of those types of questions that they have?
Yeah, so thank you, Ian, and hello again, everyone. It's great to be back. So I think, yeah, so some of the questions touched on, and particularly Paul's comment about understanding the difference between a surgical mask and a protective mask and a face covering. And I think, there hasn't been the understanding about kind of the variations in the different type of face mask and what's appropriate. So one of the things that BSI has done with the UK government is we've put together a really short guide, which gives a really kind of layman's overview of what the different types of face masks are, what protection they can give, and what standards then apply. So again, I'm happy to share the link, or you can, if you just search BSI COVID-19, we've kind of put all of these resources in a single place, so you can find it there, but I can share the link. And related to that, to again help clients understand what those requirements are, we've made available for free and the primary standards that govern what these different types of PPE actually need to have in place, and they're all freely available now. So if you are thinking about, and I'll come back to this, but if you are thinking about, for instance, surgical face masks as an additional layer of protection for those who might be exposed more directly, first aiders, for instance, or the security guards, I think was mentioned from ISSS, then you can actually look and see what those requirements are. So that information's out there. I think the other thing relatedly that we've seen is this piece around availability of PPE, and actually whether it's from reputable suppliers or not. So one of the things that we have for all the PPE that we certify, there's two ways of checking whether it's genuine, whether we've actually done the testing on it. You can check on our certificate. There's a link, and it will take you to a website where it can confirm, or we have a software system. So there are ways and means of checking that. Your first point of call is using a reputable reputable supplier, you know, and then if you've got any doubts, then you can do those checks in terms of where they've actually been certified. And then kind of the wider piece, just to make people aware of, again, working with the UK government and actually Europe, is, you know, absolutely recognise that there's this global shortage in terms of getting PPE through the supply chain and onto the front line, you know, and there are these requirements around specific standards and then the testing of those, you know, to get CE marking, for instance. And what's actually been happened is a fast track process has been agreed to try and increase that throughput. And actually we've been doing work with suppliers in China to upskill them in terms of what that requirement and what that processing is. So it's not going to wave a magic wand and cure our, you know, the global supply chain, but there are, you know, global efforts going on to try and help and support. So I wanted to kind of give that context for people in terms of the standard side of things, and what's going on. I think the other questions then we've seen is, you know, what is appropriate in terms of looking at PPE to manage the COVID-19 situation. Obviously, any PPE that you have in place to manage existing health and safety requirements, you know, still need to be in place because they're already there, you know. So whether that's actually, again, you know, particular protective masks for managing dust, you know, those things need to stay in place. But when we look at for COVID-19 and in particular, I'm going to focus on disposable gloves and masks, then, you know, I think there has been a lot of questions, and, you know, absolutely, you know, John from ISS and Paul, you know, that risk-based approach is really key. You know, it is absolutely not appropriate to be doing a kind of a blanket rollout of disposable masks and disposable surgical gloves to all of your workforce in all circumstances. It needs to be risk-based. You know, it is the last line of defence. Paul made the comment, which made me smile, that people think they're Superman when they're, you know, when they're wearing this equipment. And the key thing to understand is that actually it is the last line of defence, and the best forms of control against COVID is the hand hygiene and the social distancing. And of course, if people are wearing gloves, they forget the hand hygiene. They're still touching things, their gloves are getting contaminated, but they don't wash their gloves, you know, and they touch their face with their gloved hands, thinking that somehow that's going to make them safe, and of course it doesn't. And you know, and a similar piece with the mask as well, you know, that obviously provides potentially some protection if you are you know, you're transmitting the virus, and you know, and particularly in situations like public transport. But again, you know, the masks in themselves become an infection agent or a transmission agent, because, you know, they're picking up potential contamination on the outside from, you know, if you're in public transport, you're breathing into them on the inside. You know, again, if you don't know how to take them on and off properly, you're potentially contaminating your hands and then surfaces if you're not doing the hand hygiene piece. You know, one of the things we're seeing is, you know, some people are wearing either sort of more recognised disposable surgical masks or just face coverings, you know, and then they're getting to the office and, you know, taking them off and just kind of putting them down on the desk or around. And again, you know, that's spreading potentially spreading the virus in a different way. So all of these things need to be considered, but it is absolutely risk-based, and you shouldn't be taking this blanket approach, you know, and giving everybody everything. I think, you know, and this might be a nice point to sort of hand on to our other speakers. I think the only, not caveat, the only thing I'm seeing from our clients, and particularly is workers, is, you know, there's a lot of anxiety with relation to, you know, the spread of COVID, and there is reassurance in wearing a face covering, particularly when they're out in public or on public transport. And I think, you know, employers need to recognise that, and recognise that, you know, their employees may want to wear a face covering on the way into work. Therefore, they need to have established a process for them managing those face coverings when they do get into the office, and guidance to kind of help their employees when they're coming through. So it is a challenge, but I think, you know, as people follow a proportionate risk-based approach, then the key things is the hand hygiene and social distancing first and foremost.
Thank you, Kate. I can see a few comments coming through on chat from Karen and Bijan. Maybe Karen, would you like to elaborate on, rather than me reading through, for the benefit of others? Hello, Karen. Is Karen there? If not, I can read the chats. Let me just answer or ask Bijan's question, then I can get myself organised to cover Karen's. Bijan, you've asked around Spanish mask standards. UNE 0064 and 065 is officially approved in EU. Would anybody answer that question?
Not off the top of my head, but I can find out the answer. I can ask our teams about it. So I'll just make a note of it. So UNE 0064 and 0065. So they're a Spanish one. Question mark approved in UK. I can potentially see if I can get an answer to that while we're talking to while we're talking to others. The beauty of technology, I can see if I can Skype somebody.
Yeah, thank you. So, the whole point of this is we're learning together. It's and we're answering. It's not I guess an interrogation, where it's quite informal. So anything like that you could do. Yeah, thank you, Kate. That'd be much appreciated.
Similarly, I'll take that away as an action as well. Now, again, to be fair, we work for the industrial side of Ansell, so not face masks, but on the medical side, for sure, that's a part of our business. So I'll also report back.
Yeah, thank you. If it is within this time, great. If it's not, we can just need to work out how we can probably. So I'm just thinking maybe something as a link onto the site. Within the section related to Soft Focus Live, so we can find a way. Kate, there are also some comments from Karen on chat. Maybe you'll be able to have a read of those while I move to cover some of the other areas, and then see if there's anything that you wish to cover further once you've read through. So. Yeah, okay, right. So thank you, Sue. Yes, we can link information on the software. So Karen's comment is, BSI guidance issue is organisations should support workers who choose to use a face covering not required by the organisation. For example, homemade face coverings or other face coverings not provided by the organisation. Ensure FBOs have to do a risk assessment anyway under health and safety law. So whether face covering is allowed or required is covered by that. Would not allow any non-FBO specified face covering to be used in a high care or risk manufacturer. So I think, Karen, you've made some comment around BSI guidance and FSA guidance. Just wonder if you're able to elaborate, or maybe Kate could have a look.
Sorry to be awkward. So the DEFRA and the FSA pulled together about 3 weeks ago some Q&As, which turned one simple sentence or two into 12 pages. And that was all about face coverings versus face masks and respirators and all the rest of it, and how they're defined. Because the issue is people turning up with basically a filthy rag on their face and saying, I want to wear this at work, which in my sector with high care, high risk is really not on. We can only let specified protective, PPE into high care, high risk manufacture. And there's all the things with disposal of the things, storage of them, and the basic hygiene, etc., all of that. So the law actually says, under health and safety law, that the businesses have to do risk assessments and assess all the risks presented to the staff, and then of course, to the product too. And so it's judged by DEFRA, FSA, and the whole industry group, a load of trade associations are piled in on this, that it's really part of the standard risk assessment, and it's up to food businesses to decide what's permissible. We don't let people wear their woolly jumpers or bring your own gloves in or anything like that. So face masks is no difference. In fact, it's even worse because they really become a source of contamination and very problematic. So that's why the guidance in 12 pages says this several times. It's up to the FBO to decide what's appropriate PPE in terms of face coverings, and there's substantiated basis. So the bit that I quoted was the sentence that is, shall we say, problematic. The rest of the material that follows that, washing your hands and all that is fine. But the issue is that the DEFRA FSA guidance has not until the past few days been publishable because they didn't know where to stick it on their websites, believe it or not. So if anybody from DEFRA or the FSA is on, it's just oh my God, how can we get in that situation? So we did the work, and it sat there for 2 weeks, this document, and in the end, the IFST has published it as well on their coronavirus hub in 2 places for SMEs and for larger businesses, and we've published it as well, just to give it a home. And I understand it's also on the DEFRA huddle, but I don't know who can see that in industry at all.
Thank you, Karen. Thank you for elaborating. Shall I? Anything else, Kate, from your side before we move on?
No, I mean, it's great to know that guidance is out there, and yeah, it is absolutely, the risk-based approach, and I think actually the food industry is much more geared up for dealing with this because they're so aware of the challenges that the introduction of PPE can introduce into kind of the food safety management. I did a back in the day when I was at HSE, I did quite a lot of work in dermatitis in catering, and we did a lot of work at looking at what the potential controls and solutions were, and worked very closely with the FSA. And I remember vividly, the discussions about the use of gloves and disposable gloves in various scenarios, and the pros and cons of that. So I think as a sector, actually you're most geared up out of all the sectors that I'm dealing with in terms of understanding the practical applications of terms of PPE, in terms of protecting people and products in this context. So no, it's great to know that there's additional guidance out there for those who aren't so familiar or aren't as high risk. I think that will help a lot. So thank you, Karen. I'll add that to my list of things to read. It sounds like such beautiful light reading.
Okay, thank you, Karen. Thank you, Kate. Much appreciated. Now, I'm wondering whether we can just touch on the question of temperature. Yes, Karen, so if we can publish DEFRA FSA guidance as well, so we can put a link on the site as well for that, so we can liaise with Sue afterwards. So temperature monitoring, it's a question that David asked. Has anybody or have experience in this area? I know, as I said, within our own business, it's something we're talking about more. If there is, great, maybe you can.
Yeah, it's something obviously we've got quite involved in this. So some of our clients have instigated their own, and others have come to us and asked for advice. So we're saying that there are 2 primary methods. One is the use of thermal imaging cameras, which are quite expensive, but for the higher footfall entrance areas, so for the larger manufacturers, they work quite well. They can't detect or diagnose the virus. They are literally just going to take the temperature, and it will highlight people that need further investigation. They're then removed to a holding room. They're further tested. There are some issues in that everybody is being encouraged to walk, run or cycle to work. Therefore, some people are arriving at work slightly warmer than they would do normally. So you have to have, a control measure in place. We haven't purchased any of the thermal imaging, but we've helped with the location of them. And we have a screened area away from so immediately after turnstiles, small gazebos have been put up, temporary structures. There's thermal imaging where it's an internal entrance. We've got it screened from the security or the reception desk. And in smaller sites and in other sites, we're using handheld infrared thermometers. So we've purchased a number of these. We're using these on our staff as well. Again, it's only an indicator. A lot of our staff are carrying out these, so we've had to go through additional training. So again, there is some screening. There is an increase in the specific PPE that's required. There are a number of different infrared thermometers, handheld thermometers on the market. We've sourced a supply of 2 or 3 different types, depending on customers' budget and our budget. And again, it's one of a number of measures. It's not the only measure. So the increase in the questionnaires, the pre-entry questionnaires, the physical checks, people that are regularly coughing, people that you know, the asking them the additional questions, and this is an extra safeguard. It's not a catch-all situation. There isn't one catch-all for any of these areas, but I'm happy to share the model details of the cameras that we've got.
Thank you, Paul. I'm just, I'm thinking of a subject for our next Soft Focus Live. So I know there's a number of questions coming through GDPR. If someone refuses, I'm just mindful that we have a number of panelists to discuss around PPE. But it'd be good if I would suggest if we have time, great. If not, maybe we elaborate on the next one. Maybe we can bring some other companies together that have experience in this area as well. So Carol, I can see on chat that you've sent some information. Francis as well. Just trying to read, sorry. Around whether a high temperature is NHS has reported sufferers of COVID-19 not having a high temperature, so it does not score absolute control measure, which I think, Paul, is your point as well. You're right, it's an indicator. I know, David, you've asked around GDPR, Francis, if someone refuses to have temperature monitoring. So I think, let's take the opportunity for the next call. We can put a little bit more time into this, because I'd like to get some of the other panelists as well. So thank you everybody so far. Maybe we could then talk further around the practical implementation of PPE, and we have panelists from retail, manufacturing, and food service. Maybe we could start from a retail perspective, where PPE and the experience, there's more experience that's being gained. And Peter, I think you previously talked about, or was it Fiona, Kibby, sorry, on previous calls around people then, to the point of becoming Superman, where they're wearing PPE. Are you seeing any changes in the use of PPE either by the public or within stores? And what are you learning as you progress through COVID?
Good question. What we're learning, I think the goalposts are moving constantly. I think we've certainly made the point, and it fits in with what Case has just said about the effect on human behaviour of giving them something that they feel makes them invulnerable. Actually has. We adopted a position, and it was obviously a very emotive topic early doors with the pandemic, that clearly social distancing and hand hygiene and surface hygiene, etc., were the best controls, and that we would provide masks and gloves for use if colleagues wished to use them. I think we need to be mindful that if you do a risk assessment and specify the requirement for PPE, you are then obliged to ensure a continual supply of kit that is actually fit for purpose. And some of that kit potentially could be better used in very high-risk situations by other organisations. So we saw simple masks, and colleagues were available. They were available to colleagues to wear if they so wished. I would say we are seeing less and less use by colleagues as they become more comfortable with a working environment where social distancing is happening to a considerable extent. There are anomalies. usually down to customer behaviour, and sometimes that's actually driven by mask wearing, where they want to make an inquiry, ask a question, and because they're muffled by their own mask, when the colleague says, sorry, I didn't hear what you said, the customer then charges into their personal space to shout at them. So it's actually another example of how so-called PPE can exacerbate the situation. So in store visits I've made over the last couple of weeks, I would say use by colleagues is very, very low indeed. In terms of customers, hard to measure versus the total number of customer visits we see across our stores at the moment. Pretty random. And I would say, you know, combination of dust masks, handkerchiefs, medical masks, all usually being abused in the way that Kate described. Gloves, from gardening gloves, marigold washing up gloves to surgical gloves. People just don't get the point. So the concept of use of as PPE by the public, I think, is a bit of a busted flush. And it is perhaps unfortunate that people can turn up in the media saying, we think it's a good idea. I think we all know that it's a good idea as a last resort, provided all other reasonable precautions are in place. First off, and we always have stressed those amongst our colleagues. If you wear gloves, fine, but hand washing comes first. If you wish to wear a mask or your own face covering, we're not in the situation Karen described with high risk food production, but we apply some rules about meeting our brand standards, so nothing offensive, nothing scary, but you just see very, very little of it. So I wouldn't say it's a non-issue, but it has not proved to be the great issue that perhaps we feared at the beginning of the pandemic. And just fitting in with the well-being thing, I know some of my counterparts through their risk assessment have described the use of face masks as useful in relation to mental health and well-being, not as a specific safety requirement to overcome the issue around obligation for fitness purpose and things like that, which I think is a sound approach.
Thank you, Peter. Thank you for the update. And I would have asked the same of Fiona from Two Sisters early on in these Soft Focus Live. Fiona, I think you were discussing around the use of face visors and fairly early on, and I just wondered what experience you've seen over the last month, I guess, since you were last discussing it. I can't remember.
Yes, on a number of sites they've made face visors mandatory to wear, and exceptions are for medical or where they're dealing, or where their colleagues are working in environments where they get steam, so if they're working over a cooker. So for safety reasons, the safety social distancing measures are in place, but colleagues still need to communicate and talk to each other. So it was looked at and it was advised that face visors would be a better option, so they could at least still communicate face to face and still offer them that protection. So I was at a site yesterday and without exception they were wearing the face visors. I spoke to a number of colleagues and myself wearing a face visor, I could get a little closer and discuss and ask how it made them feel. Do they find it useful? And they were very happy that they had to wear them and that everybody else was wearing them. And they actually said it feels better. You feel as if you're closer to people that you're now working with. And the controls are in place. They still have to keep them clean. They're not meant to be touching them. But I think if everybody's following the same guidelines, everybody's there psychologically, they feel better. Plus that human bit's back again for them. So there's still the screens up and there's still the, you know, the separation, But the mandatory wearing of face visors seems to have gone down very well with colleagues. There's no face masks allowed, again, for all the reasons that we've talked about, as in a food industry environment, but the face visors seem to be doing what we want it to do, which is provide protection for the welfare of our colleagues, and then they also still feel part of a team.
Thank you, Fiona. And have you seen any changes in the way you approach other PPE? So, for example, gloves and their use.
Well, the use has gone up considerably. They're now using gloves in areas where they wouldn't traditionally use gloves. So if there's common equipment that people will touch, they will use gloves, although we've got strategic cleaning in place for those items. So sites have got additional resources where someone's job is to go around and wipe down and clean common touched points, but people are still wearing gloves for that purpose. So if they're touching the handle of a pump truck, or they're handling squeegees or shovels, if they're not hygiene, whether they're doing line clean downs. So we are seeing an increase in the use of gloves. We're the same as everybody else. We're I wouldn't say struggling. We're managing our PPE stock very, very tightly because we're aware that it will be our pinch point. So we're managing to get stocks to the sites and keep them up and running, but we do know we've got to be very mindful of how much of it we're using. So we'll come to the point where we have to rationalise our colour coding system. So if we can only get one colour of mob cap, for example, or apron, for example, we're going to have concessions in place where we've got colour coding for food safety segregation requirements, and then focus on how do we manage the GMP of that situation when we're saying we're no longer going to wear yellow for nut control because we can't get it. So we know there's going to be some more challenges coming ahead that are a combination of the PPE that's out there that is needed for medical and people's welfare and safety, and the PPE that we use for our food safety requirements. So we've already got a bit of a clash going on there. So I think that's about it for us. We ran out of face fitting masks a long time ago, so we went to reusables. So full face masks with filters. So we issued them to all colleagues on site who require them for where we'd already risk assessed them for health and safety. So they got a full face visor. Some got air hoods also, and they've got used to wearing them. We don't issue any other masks. We've got security guys who are also concerned where they're maybe talking to a driver and the driver's up in a cab and they're talking down at them. So they've expressed a bit of concern, and maybe we need to, again, as it was said at the beginning, look at those particular instances and what more can we do to provide protection or the safety for those individuals. At that point, the security guys see a lot more people than the receptionists these days because we have no visitors.
Thank you. Thank you, Fiona. It's yeah, interesting to hear the update. And I'm just trying to monitor. We've got a number of comments coming through on chat. I think we're going to struggle a little bit on time, so I'd like to have got to Emily from a food service perspective. I see that, Kate, you have an answer on Spanish standards. So if I just read that for Henry's benefit, there are a number of countries in the EU developing standards for masks for public use. None have been accepted by the EU. CEN may be developing, but no timeline at the moment. So again, if we maybe get any further information, we can update on through the SOFHT website as well. So thank you for coming back to that. I would like to then move to Emily as far as from a food service perspective and within Starbucks, maybe just your experience as the food service industry starts to open. I know we've heard from some of the other panelists in the past around some of the areas we're looking at social distancing. Also, we're focusing on PPE this time. Again, maybe give some examples of what PPE you're looking to use or are currently using, and any of the challenges that come or any of the areas that you've had to consider around that.
Yeah, sure. Thanks, Ian. So we're a little bit behind kind of retailers in terms of when we opened up. So we've only been open a couple of weeks now, and I guess we've really had to adapt and learn quite quickly. And I think it just comes back really to what Kate shared in terms of a risk-based approach. So we haven't identified the need for PPE as part of our risk assessment. So the main controls that we have are social distancing in terms of staff deployment and putting them in fixed positions, and then in terms of our customers as well. And then the two other key controls are the increased cleaning and then of course hand washing. But in terms of gloves and facial coverings, we haven't mandated these at all in our stores. But we have said to our staff that they can wear them if they wish. But because of supply constraints, what we've done is given an allowance to our staff so that they have an allowance so they can go out and either source their own or they can make their own facial covering. And I guess the communication around this was really for where we've got staff that are travelling into work on public transport, so that we're aligned with kind of that government advice. But then in terms of our in-store operations, we've had to change these quite a lot. And we've kind of assessed tasks where actually normally we would have two members of staff to do that task, and how we've kind of broken it down so that we only need now one member, but we have still got tasks where they do require two. So we have got we have sourced facial coverings for those particular tasks, but not really given them out to each partner as a kind of a standard. And that's really the same with gloves as well. We're not using gloves, and we're really pushing that message around hand washing is key. I guess some of the challenges that we're facing into at the moment are around customer perception. So where we have got members of staff that have decided to use facial coverings in store, we're getting a lot of kind of customer queries and complaints through saying that you know, they're not really sure why the whole store isn't wearing a facial mask, or they've been to another store where they're not wearing them at all. And there's really kind of, I guess, different standards across stores because of the fact that we haven't mandated them and we're just giving them the option. And then yeah, that leads into kind of that customer confidence piece, and are we doing enough as a brand and a business to kind of give them the perception that we are operating safely? And I guess that kind of comes into some of the challenges that we've had around our staff as well on where they wanted to use them. Yeah, and that's really where we are at the moment.
Thank you. No, very interesting. Thank you very much for providing that information. Thank you. Now we have a few minutes left, so we need to just agree topics for our next discussion before I hand over to Fiona. I can't see before that any questions coming through, comments on chat. I think there was. Let me just go back. I know I said there were a few to go back to. Yeah, we said that there's a number around temperature checks. I think so. That would be a topic for next time. Laura, I see you provide some information on. I've seen a recent report on best material for homemade masks, high grade, thread count, cotton, benefits of double layer material, etc. Is there any merit to this type of reporting? This query is for public use, not for food manufacturing. Anybody got any comments on that area around?
Yeah, if I may, I mean, the advice and guidance that's kind of out in the public domain in terms of face coverings is very much based on comfort and how to make them. You know, I think it's really important to understand that they have no regulatory emphasis on them at all. You know, it's purely based on sort of, you know, I wouldn't say made up, but sort of, you know, as I say, principally comfort, you know, and types of material. So yeah, in simple terms, no, there isn't any merit. You know, I think we've discussed face coverings, and it's just important to understand that, yeah, they're more of a, I think some of our colleagues mentioned earlier, you know, kind of a well-being piece around reassurance for individuals as opposed to meaningful protection in any sense.
Thank you, Kay. now I'm mindful of time, for just sort of discuss for next time. So temperature monitoring. Any other areas that people would like to discuss or bring any panelists together for? Or maybe you can drop a note through chat or to the SOFHT office. It does help. Andrew, you're asking for Sue's email address, so we'll get in contact with there. So any other areas for next week? No. Okay. Well, look, if anybody does, please let us know. We'll put our thinking caps on and wait for any feedback as well. So, Fiona, if I could hand over to yourself to close as chair.
Yeah, thanks, Ian, and thanks everybody for their contributions today. I think we had a fantastic conversation. As usual, I've written copious notes, some fascinating information from different sectors of the industry, which I think is where we really bring some value in these conversations, is having the manufacturers and the retailers and the food service industry all on one call. We can all learn from each other, and I think that's been most helpful today. Also, thanks to all of those who suggested some links and some documents that we can all take a look at. I know Karen Goodburn posted something on LinkedIn last week, which was an excellent animation around mask wearing and the benefits or not of the general public wearing masks. So I'll see if I can dig that link out as well, because it just sums up very simply in a nice visual format some of the issues we've been discussing today. So yeah, I just want to say thanks again to everybody. Ian and I and Sue at SOFHT will have a little bit of a chat about what we can bring next week. I think the thermal imaging cameras, maybe hearing a little bit more about how they work and their strengths and weaknesses, and actually what would be a practical operation of a process on that might be quite interesting. They're certainly becoming a bit more predominant in perhaps a warehouse situation, so might be able to get some speakers from that perspective. I also wondered about quarantine situations. So we know the government is looking again at its policy around quarantine for foreign travellers. And air bridges. I'm just thinking, if you do have a workforce who decides or is able to go abroad over the summer months, what extra risk assessment you might put in place for their return back to the workplace. So certainly sparked a few ideas in my head. So thanks very much to everybody, and I won't take up any more of your time. We look forward to you joining again next Wednesday. So thank you, stay safe, and have a lovely afternoon.
Thank you.
Thank
Thanks.
you.
Goodbye.
Lovely.
Thank you.